Bold claim: mental health isn't simply a personal failing or an illness you catch in a moment, it's a complex, evolving part of everyday life that society often mistakes for a medical problem. But here's where it gets controversial. Many GPs say the current system overdiagnoses mental health issues, even as demand for support climbs. This tension sits at the heart of a national conversation about how to define distress, allocate resources, and provide real help. A BBC investigation surveyed over 5,000 GPs in England, with 752 participating. The responses reveal a profession wrestling with two opposing pressures. On one hand, clinicians worry that normal life stresses are being medicalized. On the other, they fear patients are not getting timely, adequate care for genuine mental health conditions. Notably, 442 of the 752 doctors believe overdiagnosis is a concern, and a larger share felt it happens only a little, rather than a lot. Meanwhile, 81 respondents believe mental health issues are underdiagnosed. Beyond diagnosis, access to care remains a central gripe. GPs highlighted a lack of suitable support, difficulties caused by housing, employment, and finances, and the impression that many people seek diagnoses for normal life challenges rather than true clinical conditions. One GP summed up a common sentiment succinctly: life stress isn't an illness. Others reminded us that heartbreak and grief are painful but ordinary experiences we all must learn to cope with. A few doctors pushed back strongly, accusing some patients of dishonesty or manipulating the system. Yet the broader pattern shows a health system under strain, with significant concern that resources are being diverted from those with more severe needs. Survey data show roughly 1 in 5 adults in England report a common mental health condition like anxiety or depression, according to NHS England. The figure is even higher for young people. Among 16 to 24-year-olds, about 1 in 4 report such conditions. The doctors who participated in the study consistently flagged 19 to 34-year-olds as the group most in need of support, with some noting a perceived drop in resilience since the COVID era. Responses varied. Some GPs argued that the real issue is underdiagnosis and a failure to fully assess or diagnose, while others emphasized the social and economic roots of distress, urging acceptance and practical help beyond a label. A recurring challenge is that many patients come to medical appointments with concerns about mental health, but the clinicians worry not all cases meet diagnostic criteria or benefit from medication alone. There are about 40,000 fully qualified GPs in England, and the study's respondents may not perfectly represent the entire profession. The duration of mental health work has risen for most experienced GPs over the past 5 years, driven by 1. Gaps in quality, accessible mental health care elsewhere, 2. The impact of housing, work, and finances on well-being, and 3. Patients presenting with what may be normal life challenges rather than clinical disorders. Earlier this year, Health Secretary Wes Streeting suggested overdiagnosis and a risk of people being written off. He later described those remarks as divisive and acknowledged the complexity of the issue. The ADHD landscape highlights ongoing strain. Estimates suggest 2.5 million people in England may have ADHD, including undiagnosed individuals, while some services have stopped taking new patients due to capacity limits. Patients have described the difficulty of obtaining timely, high-quality care. Overall, most GPs in the survey agree there isn't enough good mental health care available locally, especially for young people. Some doctors labeled the state of services a national tragedy, while others warned that thresholds for serious concern can become so high that urgent needs are overlooked. Medication is sometimes prescribed as a stopgap when access to talking therapies is slow, according to 447 GPs. One doctor admitted relying on antidepressants frequently, fully aware this may address short-term symptoms but not prevent recurrence. Experts weigh in on the balance. Professor Victoria Tsotsier-Brown of the Royal College of General Practitioners stresses the delicate line between recognizing genuine concerns and avoiding the over-medicalization of normal feelings. She urges careful clinical judgment and warns against pressuring GPs to diagnose where it may not be appropriate, while also warning against dismissing real distress as mere overdiagnosis, which could discourage people from seeking help. An independent review into mental health demand has pledged to consider all evidence and propose practical recommendations. Mind, a mental health charity, notes a lack of credible evidence for systematic overdiagnosis, while pointing to a rising prevalence of mental health issues in the population, about 1 in 5 adults, per national surveys. In summary, the current moment reflects a health system at a crossroads: rising demand, limited access to high-quality care, and a professional push to treat genuine distress without over-pathologizing normal life experiences. The coming review aims to balance these competing realities and provide constructive paths forward. What's your take on where the line should be drawn between recognizing need and avoiding unnecessary medical labels? Share your perspective in the comments.